Do you know how a simple microorganism can enter a human body and can cause serious health issues? And do you know how we can make use the microbiology knowledge to prevent this dangerous situation? Hi everyone, welcome back to my channel Pharma Talk with Imran. In today's video, we are going to discuss the basic principles about the microbiology. Let us start the video. The basic principles of microbiology. So in this video we are going to see the different topics like why microbiology is important, then what is the importance of microbiology in healthcare, then what is the role of nursing practice, then what is infection control and how can we prevent that one, then what is patient care and safety, and what is sterilization and disinfection, what is immunization, then sample collection, then nosocomial infections, that is hospital acquired infections, their definition, types, causes and prevention. Then relevant to pharmacy practice field, so here we are going to see about the drug development, how the microbiology is helpful in drug development, then antibiotic sensitivity, then sterility testing. So here the microbiology, why we need to study the microbiology, what is the importance? So it helps to understand the disease and infections. So for example, any disease that is maybe COVID or maybe malaria or maybe TB, whatever it may be. So by studying the microbiology we can identify the what is the causative organism for that particular disease and how can we prevent that one. It also helps in diagnosis of the particular disease. Then it is essential for the drug development also. The microbiology knowledge is very helpful in developing the drug also. Then it also helpful in maintaining the hygienic conditions so that we can control the spread of infection. Then it also supports the biotechnology and vaccine production. Then in relevant to nursing department, why it is helpful means we can understand the infection and the disease transmission process, so we can take better care of the patient. Then we can use the proper antibiotics. Then we can also prevent the hospital acquired infections. So here there is a chain of infection, how the infection spreads. Usually the infected person body fluids, especially in the form of droplets or any other type of body fluid, during sneezing, coughing, whatever it may be, it will spread to the surfaces that will be touched by any normal healthy person, and it will leads to infection in that person. So that this is the route that will by that way the infection is going to spread in the patient. So infection control, so it is very much important, that is we can control the infection by proper hand hygiene, then by using the PPE gloves and mask, then sterilization process. So for example, the spread of COVID-19 is prevented by using proper mask and hand washing techniques. Then patient care and safety. So understanding the pathogens means microbiological knowledge helpful in proper wound care, then isolation techniques, especially in management of the patient who are suffering from tuberculosis. Then sterilization and disinfection. If we know the microbiological knowledge, we can sterilize the instruments which are used in the patient care and treatment. So that if we know the microbiology knowledge, we can know that at what temperature the microbes will die. Specific temperature the microbes will die, so that we can use in sterilization process to sterilize the surgical instrument, and we can prevent the infection. Then immunization and awareness. So here the nurses is supposed to educate the patient about the vaccines. Then sample collection and diagnosis. So if we know the microbiology knowledge, it is helpful in how to at what temperature, at what procedure is adopted to collect the blood sample, urine sample, sputum, whatever it may be. Then it also helps in pharma field like drug development. So it also helpful in discovery of antibiotics, vaccines, for example production of penicillin from fungus. Then it also helpful to understand to avoid the antibiotic sensitivity and resistance. So it helpful in the pharmacist to choose the correct drugs to prevent the antimicrobial or antibiotic resistance, and it also helpful in avoiding the misuse of antibiotics in viral infections so it is not useful in viral infection, so it is only effective against the bacteria. The antibiotics only effective against bacteria. Then regarding this asepsis technique, asepsis means here keeping the area or object completely free from infection. That is, there are different types of asepsis like a medical. So here it reduces the number of microorganisms, example hand washing, cleaning surfaces, surgical asepsis, sterility techniques. Then eliminates all type of microorganisms. For example, in sterilization process we are going to sterilize the gloves, sterile instruments during surgery. So here we need to sterilize the surgical instruments to prevent the infection spread, and we need to use sterile syringes to prevent the infection, and in case of dressing wounds with sterile materials and maintaining the clean hospital environment. Then nosocomial infection, or you can say it is also called as hospital acquired infections. So by the simple definition, it is defined as infection which is acquired after 48 hours of hospital admission. Means before entry of the person to the hospital he is normal, but after 48 hours he is getting infection. Means here the infection that is the patient getting in the hospital or healthcare setting, which was not actually present at the time of admission in the patient's body. Then the common types of hospital acquired infections, like the patient may get UTI, that is urinary tract infection, or respiratory infections, that is after using the infected ventilator. Then using surgical site infections, means at the time of surgery the patient may get infection. Then blood stream infection, during the time of blood transfusion the patient may get infection. Then what are the causes for these hospital acquired infections? It is poor hygiene practice and contaminated instruments, using contaminated instruments like gloves, syringes, whatever it may be. Then improper sterilization. If the sterilization is not proper, then still the microorganisms is present in that instrument, that will cause infection in the patient. Then weak immune system. If the patient is having very weak immune system, that also main cause for hospital acquired infection. Then there is a cross infection from the healthcare workers. If the healthcare worker is suffering from so and so infection, that will be infected to the patient also. So the examples: a patient is admitted for the fever, develops pneumonia after 3 days, or a patient after surgery get infection due to use of non-sterile conditions. How can we prevent this one? Proper hand hygiene, use of aseptic techniques, then sterilization of equipment, isolation of infected person, then use of proper PPE, that is personal protective equipment like gloves, mask, etc. Then sterility testing. So it is used in to ensure the drugs which are free from microorganisms, especially in case of injectables and eye drops. This sterility testing is compulsory done to check the formulation should be completely free from all type of microorganisms, because to protect the patient from any infection we should use all these formulations sterile, because it is directly entering into the blood stream. The injectables are directly entering into the blood stream. Then it is also, the microbiology knowledge is also useful in pharmaceutical manufacturing like fermentation biotechnology. For example, we are going to prepare insulin production by using recombinant DNA technology. It also helpful in the microbiology knowledge is also helpful in quality control, because we need to check the raw materials before it is used, and we need to check the finished products before it is released to the market. Then final conclusion. So the microbiology knowledge is helpful in understanding the microorganisms and disease identification, and how can we prevent and treat the disease,